Okay.
All right, what we're gonna go over is a little bit of lower extremity proprioceptive exercises. These are not meant to be anything about strength. This is all to help you with knowing where your limbs are in space and to help with spatial awareness and help with body mapping and quote unquote grounding. So what we're gonna do with that is I'm gonna kind of just show you some real fine, nice little exercises that are meant to activate all the little small muscles and help with the balance and coordination of the joints. All right, so even just a patient just widening their stance a little bit, flat surface is usually what I have them start with, and I have them just go and squat a little bit. All right, when you're squatting just a little bit, then just hold it here. All right, and you're gonna mess with just different levels, and you're gonna find if there's areas where you kind of shake and you feel a little unstable. And if that's one of those pockets that you find, what you're gonna do is you're gonna do a little more work in that area or that little zone where you get a little more shake to it. We gotta re-educate the coordination of those muscles and joints in that range. So back to just kind of what you can do as an isometric is we can just kind of squat a little bit, and then I tell patients while you're squatting like this, now you're just gonna shift over. Then you're gonna shift over to the other side. Then while we're squatted like this, we can rotate a little bit. Rotate to the other side. Then one of my more favorite ones, which you're gonna get a little more into the knee, I want a patient to kind of put one foot forward, just kind of have that back foot help with a little bit of that stability, just give you a little more feedback. Same concept, a little bit of bend. And now you're gonna rotate, and it will torque on that knee a little bit, but our knees do have 5 degrees of rotation with them in it. And this is gonna help to kind of strengthen up that knee. Same concept, I can go a little bit lower and rotate side to side, okay? The other things that you can even do, you gotta think about just kind of pushing up on one ankle, holding it there, rotating a little bit over those hips, just kind of feeling where your legs are, and then kind of pushing up onto the other one, switching back and forth between both sides. This is just gonna be a nice, easy way to kind of help start waking up how you communicate to your legs, okay? And then when you want to elevate them, make them a little more tough, what you can do is you would usually start with something like this, a nice little pad. The pad creates that instability. So now we can kind of do this and do those same exercises, a little bit of rotation, a little bit of a squat, a little more back, a little more forward, you know, all these different combinations. A little bit tougher than that is typically the balance disc. And then even tougher than that would be the give board. And then that's, of course, real tough as far as being able to balance stability on this, coming down a little bit, holding it, and really kind of challenging that musculature.